Makikita po natin sa graph kung saan mga rehiyon galing karamihan ng ating mga kaso. Sa total confirmed cases po natin, meron po tayong 201 na nakarecover, kaya ang total recoveries natin ay 12,386. Sa deaths naman, meron po tayo nadagdag na 6. Kaya sa kasalukuyan ay nasa 1,309 na po ang nasa talaan natin ng mga namamatay. Para po sa ating mga media questions for today, galing po kay Sheila Crisostomo ng The Philippine Star. The WHO and some local experts are saying that we have poor implementation of isolation protocols for the mild and asymptomatic positive individuals who could be going around infecting others. What's your comment on this? How many positive are undergoing quarantine at home and in isolation facilities? The DOH is working with the DILG and the local government units, specifically barangays and their barangay health emergency response teams in areas where there are confirmed cases to ensure that mild and asymptomatic positive individuals are regularly monitored. Kasama din po natin ang National Task Force and local governments in managing the mega temporary treatment and monitoring facilities and the temporary treatment monitoring facilities in their LGUs. Sama-sama nating sinisigurado na ang ating isolation protocols are properly implemented. But we also remind our mild and asymptomatic patients to be patient and abide by our home isolation procedures. Tandaan po natin na pag tayo ay mild or asymptomatic patients, dapat po manatili po tayo under quarantine. Maaring sa bahay o sa quarantine facilities at sumunod lang po tayo sa quarantine protocols. As to the number of positive patients undergoing quarantine, we are closely monitoring the numbers together with the local governments through COVID Kaya. As of the moment, we are still consolidating data from the local government, from the DILG and the National Task Force in our system. Galing po kay Leigh Alvis ng GMA, are we already experiencing a second wave of cases? Has DOH looked into the profile of the new cases? Ano po ang nakikita niyong common profile sa mga bagong kaso? Marami po ba ang workers? We are not experiencing a second wave but an increase in the number of positive cases due to the increase in testing and because there is community transmission because of the lack of implementation of minimum health standards. The increase has been gradual and our health system is able to cope with the increasing number of cases. This is reflected in our indicators. As of July 5, our case doubling time is still at 7.9 days. This means that it takes more than a week for the number of cases to double, and we have enough resources to address the current needs. We were able to do this when we were given a window to ramp up our health system capacity during the first months of our ECQ, and this has helped us in our COVID response. There is no particular profile of cases seen based on our data. The recent increase is due to observed clustering in barangays in the National Capital Region and in Cebu, and in workplaces in the National Capital Region. Due to this, the DOH, together with DILG and the concerned LGU, has intensified contact tracing efforts and isolation protocols to contain the identified clusters. Galing po kay Madeline Villar ng Net25, Dr. Edsel Salvania said that the novel coronavirus mutated and mas nakakahawa daw po ito ngayon. He said that the surge in cases these past few days may be attributed to the mutation of the virus. Can DOH confirm this? The statement of Dr. Edsel provides the D614G mutation makes the virus more infectious, mas nakakahawa. There is no evidence it makes it more deadly or virulent o mas nakakamatay. However, it can spread faster and overwhelm our healthcare system if we do not do our control efforts, so it can lead to a higher number of overall deaths if we do not properly manage the number of infections. Kaya nga po, lagi po nating pinapaalala, wear your mask, do physical distancing, and strictly follow minimum healthcare protocols. The virus has leveled up. We have to level up as well. Mutations do occur with COVID-19 virus, and this particular one is more common in the world and it seems to be more infectious. We are continuing to monitor this development and our scientists are sequencing some of our local viruses as we speak. Hence, the Department of Health strongly reiterates its minimum public health standard reminders. Again, our safety protocols must be strengthened. That is wearing of mask, physical distancing, and proper hygiene. Let us continue to limit our travel to only essential ones. Should you have any further COVID-related concerns, the Department of Health hotline 1555 or 894-COVID is ready to assist you. More than 200 scientists from the different countries said that COVID-19 is airborne in an enclosed setting. Can this happen po kahit di sa hospital setting? As of the moment, we have limited knowledge on the virus and its mode of transmission. Ayon po kay Dr. Salvania, member po ng DOH Technical Advisory Group, we already assume this is airborne when we do aerosol generating procedures in our hospitals. This is why our healthcare workers use N95 mask and conduct strict prevention and control measures. As for settings outside hospitals, further study and evidences are necessary. So what does this mean? We enjoin the public to wear masks at all times to reduce the transmission of this virus. Galing po kay Red Mendoza ng The Manila Times, the latest WHO report suggests that antiretroviral medicines for HIV are impacted by the pandemic. Are our current antiretroviral drug stockpile still enough to serve our HIV patients? Is the DOH expecting a shortage of these drugs? Red, the DOH has secured stocks of antiretroviral drugs for HIV up until next year. There is also still an ongoing procurement for this drug, so we won't have any shortages. Galing po kay Leigh Alvis ng GMA News, ilan po ang COVID-19 patients na nasa quarantine facilities? Ilang percentage po ang occupied? As of July 6, 2020, meron tayong 15,303 na katao na confirmed suspects at probable COVID-19 patients sa ating mga temporary and treatment monitoring facilities. Katumbas po nito ang 23.07% occupancy rate, which is sufficient and acceptable. Salamat po sa pagbibigay sa amin ng oras nyo upang matalakay natin ang tungkol sa updates ng mga COVID-19 cases natin. Naway makatulong kami sa inyo upang maunawaan nyo po ang mga datos na inilalabas po namin araw-araw. Kami po ay nananawagan sa inyong lahat na gawin lagi ang ating minimum public health standards. Katulad po ng pagsusuot ng mask, pag sinuot po yung mask, tatakpan po pareho ang ilong at bibig at hindi lang nasa baba. Madalas na pag-uugas ng kamay, physical distancing, at iba pa, lalong-lalo na po sa mga lugar na sarado, katulad ng mga naka-aircon na lugar at mga lugar na walang maayos na ventilation. We expect na patuloy pa rin pong tataas ang mga kaso as we open up because there is more contact between people at marami pa rin po ang nakakalimot sa ating mga minimum health protocols. Maaring ang kailangan natin ay hindi ang pagbalik sa ECQ, kundi maging mas mahigpit sa pagpapatupad at pagsunod sa ating mga health protocols. Kami din po ay umaapela sa inyong lahat na patuloy po nating pangalagaan ang kalusugan ng mga vulnerable persons sa ating tahanan. Katulad po ng mga senior citizens, yun pong mga may sakit, at yun pong maliliit na bata. Nagawa na po natin ito nitong mga nakaraang buwan. Ituloy lang po natin kahit lumalabas tayo. Kung maaari po ay magstay at home at doon na lang po tayo sa bahay. Ngunit kung hindi po talaga maiiwasan ang paglabas, ugaliin po natin na mag-disinfect tuwing dadating po tayo sa bahay at bago po tayo makisalamuha sa ating pamilya. Huwag din po natin i-underestimate ang magagawa ng pagsusuot ng mga mask at pag-physical distancing sa ating laban kontra COVID-19. Napakahalaga po na isaisip natin ito, isapuso at isagawa po natin ito. Alam niyo po ba na ayon sa mga pag-aaral, makikita po sa inyong mga screens, kung magsusuot po tayo ng mask, mababawasan po ang tsansa na mahawa ng 85%. Kung mag-o-observe po tayo ng physical distancing ng 1 metro, mababawasan po ang tsansang mahawa ng 80%. At kung mag-face shield naman po tayo, mababawasan ang tsansang mahawa ng 78%. Hindi pa po tapos ang laban natin kontra COVID-19. Kaya kami naman po ay nagpapaalala muli sa ating mga kababayan na maging mas mapagmasid at isagawa ang mga health protocols natin. Lalong-lalo na po kapag lalabas tayo ng bahay. Magsuot po tayo ng mask, magugas po tayo ng kamay ng madalas, mag-physical distancing ng 1 metro ang layo sa ibang tao, observe proper cough etiquette, at mag-sanitize po tayo ng ating mga workspaces. Lalong-lalo na po yung mga bagay na madalas hawakan ng mga tao, katulad po ng mga doorknobs, telepono, silya at iba pa. Huwag po tayong maging kampante. Sa halip, patuloy po tayong maging responsable. Alagaan po natin ang ating mga sarili, alagaan po natin ang ating mga mahal sa buhay at ang iba pang miyembro ng ating komunidad. Sa kamay po natin lahat nakasalalay ang kaligtasan at kagalingan ng bawat isa. Tandaan, together we can be the solution. Together we
Mas
can
naintindihan na natin kung ano nga ba ang expanded testing.